So we have Jose, and the idea is that Jose has a significant story, and that is why I brought him on here. So a couple of years ago, as he mentioned, he was weighing 300 pounds. He had diabetes. He was set up to have gastric bypass. But the problem is that when the doctor examined him, what happened?
Well, the doctor, after seeing my chart, my body weight, my body fat, he just simply said, "I'm not going to operate on you." He gave me a story. He said, "I see your liver, it's huge," and like I told Dr. Cooper, he mentioned to me, I said, if I go in there and try to fix you, if I rupture your liver, your wife's going to sue me and she's going to become a millionaire.
So yesterday I spoke about fatty liver, and I mentioned that one of the signs and symptoms of fatty liver is an enlarged liver, because the cells, the liver cells are so engorged with fat, then the liver becomes larger. So he had large liver. So the doctor was hesitant to do the gastric bypass on him, although he needed the gastric bypass because his weight was so much. He had such a massive BMI. He had what we call morbid obesity. The obesity was affecting his blood sugar, his blood pressure, and his overall health. So after you were told that the doctor did not want to do your surgery because he didn't want the wife to sue you, it means that you were poor prognosis. What happened?
Well, there was two events that happened afterwards. I went to a clinical study for fatty liver, which I, sad to say, but I passed. I was a candidate for one of their trials, right?
Wow.
So obviously you go through a process of trying to, clean your body, and then they put you through a test of some sort. And I was ready for that, but I wanted one last chance to see if I could do something different. So I started exercising, but I noticed that there was an abdominal hernia, and I went to the doctor. He saw my weight and get the same result. He said, "I'm not going to operate on you. So if I operate, your hernia is going to come back in 3 months."
Wow.
And seeing those three strikes from medical professionals, it hit me. It bothered me, and it was at that point that I remember seeing the advertisement for FoodAMed at your office in Edinburgh, and without hesitation, I came in and met Eli at that moment and Miss Donna at that moment, and they welcomed me with a lot of answers that I was looking for. They gave me an opportunity to better myself on that way.
Very good. So he came into FoodAMed. FoodAMed is a plant-based restaurant that is here in the Rio Grande Valleys on 10th Street. And I remember talking to you just now about what's going on before we continue with the story. And you were telling me about that you were going maybe 75% healthy, plant-based, and 25% not so healthy. So there's actually a difference between what we do here at FoodAMed Vegan Restaurant. So, there are a lot of restaurants that have vegan options, and a lot of places that maybe they're also vegan, but they're not healthy vegans. FoodAMed Vegan Restaurant it's different. It's healthy. We have a variety of cuisines, delicious. You don't have to hesitate. So he came into FoodAMed Vegan Restaurant. He met the employees, and Jose started our plant-based whole food meal prep. And tell me what happened when you started the meal prep, Jose.
Absolutely. So the first couple of weeks I started noticing something to me, which to me was drastic. I started feeling more energized. I was sleeping better, and my wife one night actually woke me up because she thought I was not breathing anymore.
Wow.
And the reason I say this is because being overweight, you get sleep apnea, and my sleep apnea was really bad. She started noticing that I wasn't suffocating myself. She thought something was wrong. I was actually resting, and it felt good.
Wow.
And eventually, within the first 2 months, my second blood work that I got, my A1C went from 12.7 to 10.2, if I remember correctly, and I started noticing a big difference on everything I was doing. And going back a little bit to that study that I was sent to, I had actually gone back to continue with it, and they redid the scan on me, and she comes back, the lady comes back with, there was a doctor, and he said, "I'm sorry, but you're not a candidate." I said, "Well, I was here 3 months ago, and I was a candidate." He says, "Well, your liver is not where it was before,
Wow.
and your liver enzymes are drastically going lower."
Okay. This is amazing. So I'm going to talk a little bit about what he said. So when he was over 300 pounds, he had sleep apnea. And the wife noticed, at least she knows how he used to breathe, and maybe he had the apneic spell. He would stop breathing and he was struggling. Now, after he started our meal prep here at FoodAMed and changed his lifestyle, the wife was also scared because now he had lost some weight. He was breathing better. He was not having difficulty breathing or any struggles. And she thought something was wrong, right? We thought you were gone. And then, of course, you were resting because you had better airflow to your lungs. So the struggle was less. Now, you did mention that the first time you were sent to the liver trial, that study, and you were a candidate to enter into their trial because your liver was enlarged and your enzymes were high. And after you started the meal prep here and you started to lose weight, in 3 months, your A1C went from 12.6 to 10. So that was a significant drop. But not only that, you went back to the liver study, and now you were not a candidate because your liver had shrunken in size and your enzymes were normal because all that fat began to disappear. It's amazing what healthy plant-based nutrition can do for you. Not just any vegan, unhealthy vegan, where you have a lot of fried food, a lot of processed foods, but there is a difference, and that's what makes FoodAMed, food as medicine, different from the other places. So, continue your story, Jose.
So after going 3 more months on the meals, my weight started going from 287 to 260. I even actually got my neighbors involved into a little bit. They wanted to try what I was doing. They gave it a chance, but this is a very different lifestyle. It's a great lifestyle, but you gotta realize that if you want to try this out, you gotta go in it 100% with all the faith and being positive about it. I continue with my healthy nutrition, and after a couple more months after that, I noticed my doctor said, "Hey, what are you doing?" He said, "You're losing a lot of weight." And I said, "Well, I went vegan." And doctor, I remember that remark he said, "Well, that's hard to do. I wouldn't do it." So I said, "Well, that's good for you, but great for me. Right. I'm doing it." And eventually we got we got to where my medication was taken away, my metformin was taken away, my Trulicity was taken away. Right now, I am currently taking one medication for high blood pressure, but my high blood pressure and my A1C, the last blood work that I got was at 4.7, and it feels great.
It's amazing. It's just amazing. Jose started with an A1C of 12.6, and now he's at a 4.7. When last have you been under 5? I mean, 4.6 is totally normal. Yeah? So I brought Jose because I always think of you. And we have many patients or many customers from FoodAMed who have done super well. But your case was so complicated. You see, you were morbidly obese, scheduled for surgery, got your surgery. I want to keep some of this back because I want people to keep coming back. Because there's so many people worldwide with your same problem. Obesity, hypertension, diabetes, sleep apnea, all of this. But they don't know what to do, or they believe that they have to be on medication for the rest of their lives. But it takes a positive mindset, and it takes resources. You need to know to go where. Where do I go for help? My doctor doesn't have the time or the knowledge to give me everything I need. You know, we're trained to give medication, injections, surgeries. We're not really trained to use a holistic approach to health. But actually nowadays, the healthcare industry is moving towards healthy lifestyle as the first point of care. So, Jose, I'm so happy you came in today. And if you want to leave, just leave a message with those who are listening until we continue with part 2 of your story. What would you say?
Absolutely. So, what I would tell you, whether you want to give this a chance because of necessity or by choice, give it a chance. It really truly works. Like Dr. Cooper said, the resources that you get from here, they're amazing on it. Not only do you have a doctor here that can guide you, but the staff here is very knowledgeable. I am proof of that. And like I mentioned today when I came in, I said I wouldn't be here today if it wasn't for FoodAMed. And it's not a plug, it's not an advertisement. I'm not getting paid to say this. This is really truly life. And for me, I can truly say that I am alive because of plant-based nutrition, and obviously because of the guidance that I got from you and from your staff.
Yeah, he's not paid. It's not a commercial. This is really community service. The restaurant is here for the community, but we want to educate the community so they know the effect of plant-based whole food nutrition. And that is why I called Jose back. Jose will be back here to inspire you and educate you, because there's so many people like him with the same problem. So therefore, keep following us. We're going to be here every day, Monday through Friday, from 12 to 2, anytime within this 2-hour window. And Jose he's going to tell you more about himself. He has lost 100 pounds, and he's doing well. He prepares his own meal, right? Sometimes he comes here, but now he is a graduate. He knows what to eat and what not to eat. And I'm sure he's combining this with exercise. We just spoke about exercise. So it's nutrition, but exercise as well, and many other things. So Jose, I know you have to go back to work, and you work about 20 minutes from here. So I don't want to keep you, but I'm just so blessed and happy that you came on, and we invite you to come back some other time. And our listeners, we invite you to keep listening to us, because Jose will be back and you'll hear from other people. So, Jose, thank you so much.
Thank you very much, Dr.
All right.
Cooper.
God bless you.
Thank you. God bless you.
Alrighty, we'll see you soon. Okay. All right, guys. So I am going to sign off, and I'll continue with this program tomorrow. So keep watching, and you're going to hear another exciting story or another topic. So I'll see you soon. Bye-bye.